to, get us moving here a little bit. So thank you everybody for coming. If you're a repeat from last week, thank you very much. This is not going to be last week's presentation. All 3 weeks of training that we're doing, the 9th, today, the 16th, and next week on the 23rd, are all kind of complementary to each other. There is some overlap, but really there's unique value in all 3 of these meetings. I will let everybody know the slide deck, the video recording, the Q&A, and a transcript document are all going to be made public to people. We will not be emailing them out with an email blast. They will be available for download from the state's website, and someone will put that in the chat feature for you so that you have it for where to go to download those resources when they are available. We are anticipating that by the end of this week, all that great material from the 9th training will be available for you to download by the end of this week. So all the training from today's session, once we get it all nicely packaged for you, after we've completed all 3 trainings we have today, we will get that published as well. I also am muting people once they come on in. So just to eliminate some background noise, but you all have the ability to unmute if you have a burning question you need to ask. But I will start off by saying we have this wonderful chat feature. So please feel free to put your question and we'll go through those at the end. The last session we did, we got a great group of questions asked through chat. So we'll try to do that as well. So again, welcome everybody for coming. We are now 2 minutes after, and we have almost our 300 folks. So we're about 293. So thank you, Stephanie, for the agenda slide. So we are going to do some introductions so that you know who's talking to you today. We're going to cover today a lot of information about QualiTrack, which is our online electronic provider portal. We're going to talk to you again about how to register. Covered that a little bit last week, but we'll go through some more screenshots today on that registration process. We'll cover portal sign-in and how you get people set up with accounts. We'll cover a little bit about what the system looks like. We'll give you some screenshots from the system. We're going to talk about some of the really good navigation tools to help you get around. That way you start building this idea of what the system looks like. Every system has their own kind of nuance. So we want you guys to be able to see ours. Next week, we're going to actually do a demo. So we're going to live get into the system, to our training environment of the system anyway, and be able to show you what filling out a PASRR 1 looks like. Today is just kind of an introduction with screenshots for QualiTrack. We'll also talk about how to find and create members, which is important, creating those individuals. And then we'll talk about what their member hub looks like, which is Telligence, QualiTrack's kind of a center of the whole system is the member. So we'll talk through that member hub. And then again, we'll probably have about a good half an hour for Q&As. So keep them coming through the chat and we'll make sure to cover that there. But we can go ahead and get started with introductions. We're now about 4 minutes in. So obviously I'm going to be talking a little bit today. My name is Jean McClurkin. You heard from me last week. I am an LCSW at LACS. I'm a licensed behavioral health provider. I cut my teeth starting in Colorado. I worked for Arapahoe House for 10 years, also within the community mental health space, worked Denver Health, inpatient psych for a while. So familiar with those systems. And I'm really excited to be back to Colorado. And Stephanie, I'll let you introduce yourself and then you can take it away as our other trainer today.
Thanks, Jean. Hi, everyone. I'm Stephanie Wilson. Some of us may have met last week during the training. My experience is really in IT systems and implementing them. I'm our Telligence QualiTrack implementation specialist, and my goal is really to make sure that you understand how to use the system, that you have access to use the system, and then if you have any problems, you have a resource to work through those so that we can get you using the system effectively and efficiently. So I'm going to go ahead and go into my first slide. Then I'm going to move this out of the way so I can see. Sorry about that. But this is a screenshot of the State of Colorado Department of Healthcare Policy and Financing Long-Term Services and Supports Training. And I have the link to this site up here at the top of this page. And this is where we have the portal registration and information listed. So if you go to this site and then you'll scroll down towards the bottom and you'll see a panel that says Telligence QualiTrack Review and Provider Portal. If you click on the name of that or anywhere on this panel, it will open up. And here's where we have the provider portal registration link and that official user training guide. So both of those are available for you to use and access there. Once we activate your account and send you an email with information, we will also email you a copy of this user guide, but we just want to make sure that it was posted here so people have it as a resource if they want to take a look at that. Additionally, we'll continue to post additional information here, slides, recordings, different things like that. You'll be provided another link website, I think, in the chat for that PASRR training page where we'll have that information listed there as well. But again, we just want to make sure everybody has all the information that they need.
Yeah, real quick, Stephanie, I posted both links. So there's the QualiTrack link, which Stephanie's demoing right now. And then I also put the PASRR training link, which is where all the resources of today's training and last week's training will be by the end of this week. So thanks.
Perfect. Thanks, Jean. So when you click that provider portal registration link, you'll be taken to our online process. And this whole registration process is handled online. We previously had a paper process, but we've moved to this online registration so that you don't have to pass around paper, worry about things going through the mail, getting signatures, different things like that. So you'll click on that provider portal registration link and you'll do that to kind of start off this process. One thing I want to note, and you'll probably hear me say it a couple times as we go through this training, but if you're going to have more than one authorized official for your organization, you'll have to repeat this process each time. So you'll click the link, you'll start the form and submit it. Then you'll have to close that window, come back, click the link, and kind of kick off that form again and fill it out for the next authorized official, and you'll just repeat that for each one. So when you click that link, this is the first page that you'll go to. It has some directions and some information up here at the top. But this first section is called our provider executive section, and this is where a provider executive, a manager, a team lead would enter their name, their full name, first and last, and then their email address. And then below that in the authorized official section, they would indicate who they want to be that authorized official. So for example, if I was the manager, I would put Stephanie Wilson in the my name and then my email in the email thing. And then I would put Jean McClurkin, who's going to be my authorized official in that authorized official area with her name and then her email address. Once I do that, I'll click the begin signing button. And that again starts off the process. So based on the email that you put in for that authorized official, they'll receive a system generated email with a link in it that will take them to their portion of this process. So once they click on the link, they'll get an open window that asks them to enter their basic information such as phone number, email address, regular address, and then the organization's NPI that they'll be the authorized official for. You can be an authorized official for multiple NPIs. So maybe there's 3 offices in your group. Then you can go ahead and have one authorized official over all of those, or you can have a different one at each location. Once the authorized official has completed their portion of the process and click submit, a final version of that agreement will be sent both to the authorized official and to the provider executive who initiated the process. And again, like I said, if you need more than one authorized official, that executive will fill out the form for each one of them. So this whole process is really completed in 3 easy steps. The flow is just that executive or manager or lead, team lead will initiate that. They'll enter that authorized official. They'll submit the form. The authorized official will receive their email. They'll completely fill out their part again online and submit that. Once that's done, Telegen will receive that information and then we'll actually set up that authorized official account. I do want to clarify, sometimes depending on your organization or the size of your office or just the way that you have things set up, that manager executive person may be the same person as you want to be the authorized official, and that's completely okay. That provider executive will enter their name and email address in the provider executive section, and then they'll also enter that same information in the authorized official section, submit that using that begin signing process, and then they'll receive the email and fill out the rest of the information to get their account set up. Again, like I said earlier, once all that information has been submitted and filled out, Telegen will send both the authorized official and the provider executive that final copy of that agreement, so you'll have it for your records. And then we'll also send out an email to that authorized official letting them know what their username is. We'll attach that training document, that user guide, so that they have it, and then a link to activate their account. They'll click on that link that they receive in the email. That will activate their account in the system and allow them to set up their password so that they have that ready to go. So just to recap, all forms are completed online. We do use DocuSign technology for this, and all the documents are routed via those email addresses, the appropriate parties for the necessary data that we need to collect. Once everyone has signed, that provider executive and the authorized official will receive a fully executed agreement for their records. The QualiTrack team will submit or create those accounts on our side and then send out those necessary emails with your username and the link to activate your account and set up your password. Then that authorized official will be able to create all the additional user accounts within the organization. So anyone within that organization that needs to be able to access the provider portal, whether it's to submit reviews, check on the status reviews, maybe submit additional clinical documentation, things like that, those user accounts will be set up by that authorized official. So just a couple things to note to make sure everything's aware of them. When you go through that registration process with the packet, our packet does say that accounts will be created within 3 to 5 business days, and that is normally true. But due to the fact that we're just kind of bringing you guys on live and that system doesn't become available until March 1st, we will not send those emails out until the week of February 22nd. The reason for that delay is that the activation link that we send in the email is only good for 7 days, and we don't want that to become inactive and then people are having to request a new one or different things like that. So we don't want that to be a struggle for people. So to eliminate that, we're just going to send those emails out the week of February 22nd, and then that link will be available and ready to use on March 1st when the system goes active. We do recommend that you go ahead and fill out those activation or those provider portal registration packets so that we have them and we're ready to set them up, and then you'll be able to use this system and have everything ready to go on that March 1st date. Another thing just for people to be aware of, because of industry security standards, we do require that all users change their passwords or reset their passwords every 90 days. On our login page, there is a reset password link. So you just click that reset password link, enter your username and click the submit button. You will then, or whatever email address is associated to that account, will receive an email with the reset password link. You'll click on that link, enter your new password, and you're able to log in the system and ready to go. But when you go to log in, you'll see a message saying that you need to reset your password after 90 days, and that'll be the process that you go through for that. Again, I know I've said this multiple times, but we just want to make sure people don't get frustrated. The system will be live and available to everyone starting March 1st. Again, here's that website where you can bookmark that page so you have access to the link to the portal once it becomes available. And currently that portal registration packet and that user guide are available out there. Again, this is just some extra information for you to have available. Oops, sorry. There's that website again. And then again, we have that registration link and the user guide. The other thing I want to point out on here and have available to people is that there will be help desk support for any of you that are having difficulties getting logged into the system or have questions maybe about submitting a review once that system becomes available. And our help desk number is listed here. So you'll have access to resources to get those questions answered right away. Again, that's not available until March 1st when the system comes live, but we want to make sure that you have this information and that's available to use on day one. So that really covered the whole registration process. So now I'm going to walk you through a little bit of what our system looks like. So once you get your user ID and you have your password set up and you're ready to log into the system, this is our landing page or our home page of our system, and this is what it looks like. You'll notice we have a care management square over here and a utilization management square, and then we have our bar up here with our different icons. So we're going to walk through a little bit of that today. Our focus is going to be on this portal bar up at the top, and then this utilization management square, since we're going to be using that utilization management process to submit those PASRR level 1 reviews through the system. We do have the care management box here, and you'll see it because we do have some people that use the system to do population health management, such as health coaching and things like that. So this square is here. But you guys don't really need to worry about that too much. So let's start with that provider portal menu bar. This bar will be available at the top of the screen no matter where you are in the system, so you'll always have access to these options. Over here on the top left, we have our QualiTrack logo, and this will take you back to that home page or that landing page no matter where you are. So if you went through a search and checked on a review and you want to go back and start over, you can always click on this QualiTrack logo and it'll take you back to that home page so that you can start something over. The magnifying glass really opens our search processes. So this is how you can start a member search, or if you want to search for a case or review, you can use that magnifying glass to take you to those search screens. Next icon with the 3 kind of bars in it is an icon that will take you to our task queue. So you may submit a review through the system, and then our reviewers will look at it and say, oh, it's missing a document, maybe a medication list or something like that. And then they'll send that request for information back to the organization that submitted the review. And so you may see that request for information task in your queue, and then someone can be able to complete that, attach that additional information, and send it back to our reviewer. But that's really what that task queue is for. The circle with the question mark in it is our knowledge center. So we'll have things such as user guides, maybe some frequently asked questions about the system, and some tip sheets. So if we ever add any new functionality to the system and feel that it's enough of a change that people need some information on how to navigate through it, we'll put a tip sheet out there so that that can help make any changes clear to all of you. The specific trainings that we're doing, like these PowerPoints and things like that, won't be out on that Knowledge Center. They'll be on websites that we've shared with you, but some system information and user guides are available out there for you to have as a resource. And then the last icon, the circle with the person in it, is your profile or my profile page. So you can click on that and go to your profile information where it has your address, first and last name, that kind of stuff listed there. If for whatever reason your email changes, or maybe you have a new phone number or something, you can update that information in your profile section. Every user has access to make those updates to their profile section. They don't need to send those back to the authorized and have them do those. You can go into that My Profile page and make those updates if you need to do that. And then also on this drop down arrow is our log out link so that you can log out the system when you're done using it. So I'm going to focus this part of the training on really how to do a member search. Everything that happens in the system, QualiTrack, is very member centric. So everything kind of starts with the member. So if you're going to submit a new review, you want to go check on a review, different things like that, all of that will kind of originate with that member search. So we're just going to kind of walk you through how that works today so you can get a kind of a first glance at that. So here in that utilization management box, there's a search icon rectangle that you can use, or like I said, up here in that top right hand corner of the screen is that magnifying glass. And and you can use either of those to initiate that search process. So you can click on and it'll take you to that member search screen. And then there's two ways that you can search for a member. You can either enter that member ID, which would be their Medicaid ID and a date of birth, and click the search box, or you could use the first name, last name, and date of birth search box. We do receive a load from the state, and we load that into the system of all the Medicaid members. So that's there for you to search in. I know with PASRR, you will submit those for people that possibly aren't Medicaid members, and we'll walk through how you enter them if you're not able to find them using our search process. So the member ID and date of birth works just like it sounds. You'll enter that member ID, Medicaid ID for that member, and then their date of birth, and click that search box. The system will then search through all the information we have, and if it's able to match exactly on that member ID and date of birth, it returns it in that search. If for whatever reason it doesn't return something that matches correctly, please check. I'm the worst at it, but it's always easy to mistype a number. Sometimes date of birth could have day instead of month first, and so you may have typed that incorrectly, but always check this information, make sure it's all typed correctly, make any adjustments, and click that search button again to validate that search and see whether or not that person is in the system. The member name and date of birth works the same way, other than you'll enter the first name and last name of the person and their date of birth and click that search. Again, we'll look for exact matches on this data to make sure that we're keeping member information secure. We want to make sure that you have the exact information that you need to match on someone there. Again, please check spelling, re-enter where anything may be incorrect, and do that search process again. If it is able to match, it will return that member down below the search boxes, and you'll be able to click on any of these blue pieces of data to take you to that member hub or that member's information where you can start a review. If it does not return a match, you'll see this member not found listed below those search boxes, and it will tell you obviously, or you can click add member button here. Like I said, we do know, especially with PASRR, there will be times that we don't have that member that you're submitting a PASRR for in the system. And this is when you'll use that add member button to create a member in the system so that you can submit a review for them. So we'll click that box and it will open up our add member window. Just a thing to note, anytime the QualiTrack system requires information to complete the process that you're asking it to do, there will be a red asterisk. I know it may be a little hard to see, but there's red asterisks anywhere there's information that we have to have in our system to be able to set up that person. Down here on identifiers, it asks for either social security number or a member ID. And both of them have red asterisks by them. You don't have to enter both of them, but we do need one, or we either need a social security number or a member ID, an identifier that's unique to this person. If you enter the social security number and are not going to use a member ID, you can just click the little box next to the NA saying that you don't have that information and you're not going to submit it for the person. Then once you have all that data entered, you click submit. And whether you do this through that search process or you do that through adding a member, the system will take you to what we call the member hub. I said before, QualiTrack's very member centric. So all the information for that member that you have access to view will be listed on this member hub. So you'll be able to access everything you need for that member right in one place. So you can see the details of that member listed up here. And then if you want to start a new review for this member, you'll click the add button and go on through this process. So next week in our training, Jean will take it through the next steps and actually demo in the system how you walk through submitting a level 1 PASRR for this member. But like she said earlier, we want to give you a feel for what the system looks like, how to do some of the basic processes in it, so that's not as scary next week or very overwhelming. So
Perfect.
That moves us into our Q&A portion. I'll pass it back to you, Jean.
Perfect. Thank you, Stephanie. That is your first introduction to QualiTrack, everybody. So we will do more next week, But again, we believe in giving people doses they can swallow rather than drinking from a fire hose. So we really do want you to try to get an exposure to this system before we demo it next week. So that was the purpose of today. And getting those names established and accounts set up, even though you won't be able to log in until March 1st, but at least having lists of people is going to be really helpful to start collecting and knowing what kind of data you'll need. We do know that in some facilities, there's going to be a lot of users that will need to get created. So again, helping you guys get organized for that process and start it ahead of time is really a huge piece we wanted to give to people today. So I'm going to go through the Q&A and read those off. Please feel free, keep adding to that. We've got a good list of stuff going so far, and we can talk about any of your questions on the content or other questions you may have about trainings coming up. So first up, we have copies of the presentation. So let me mention that again for folks that joined late. All of the training materials are going to be posted to the state's PASRR website. We are not going to be emailing them out as an email blast. We believe in version control, so we want to have one known good source of record of information, and the state's letting us use their website for that. So we are going to use the PASRR training link on the PASRR, the state's PASRR page, and that is in the chat. So please scroll through the chat to see PASRR link. I think I uploaded it, Obi uploaded it. We want you guys to be able to access the slide deck, the recording, a written Q&A summary from all 3 trainings that we're doing, as well as a transcript. So however you like to digest learning information, hopefully we have you covered. So that is going to be out there. And that is information about the Q&A. So I think that takes care of a few. Getting the PowerPoint. So yes, we've talked about that. And then a lot of people put their names and where they're from. And that's great. I love seeing that. So I can see where people are. And some of your facilities, I know these facilities. Uptown, know you guys. Good job. You do good work. All right. So what's the difference between an authorized official and an executive? This is a great question. I'm going to try to start it and then I'll let Stephanie correct me and fill me in. They can be the same person, but really it revolves in 3 tiers of role. There is the provider executive at the very top that says, I have permission to sign all of us up. I have permission to give our information. Then there's an authorized official that lives kind of a step below them. And those could be the same people or they could be different. And then that authorized official creates all the users. When that authorized official account gets created, they are automatically a user themselves, but they will have to give permission to the executive to be able to be a user. Just being named as the executive does not default you into being a Qualitrack user, as in someone who can submit reviews, look at previous reviews. That authorized official truly does manage all of the accounts. And again, you can break that up and have multiple people be the authorized official, however works best for your agency. But yeah, that authorized official is the only one that defaults with an automatic login. So they're different roles, but they can definitely be the same person doing both roles, however you are organized. So who needs to be the authorized official? One of the last trainings, somebody asked a great question about, hey, our IT department manages all of our user accounts. Can our IT department, who's not clinical, who's never going to submit a PASRR, can they be the authorized official so they can manage the accounts? That is perfectly fine. Your authorized official can truly be anybody at your organization. There is no criteria around who that person is, just whoever makes the most sense to manage and create accounts as people need them. But again, once you get your own account, you can manage your own information. You can reset your own password. You can do lots of stuff once you get created. Slides available. We covered that. All the stuff will be out there. Is the provider executive also an authorized official? If you want them to be, yep, they sure can be. And they will need to be set up by the executive, by the authorized official as a user themselves. Executive is not automatically one. All right. Do we continue to submit PASRRs to EQ? Obi, I think this one's going to be for you. Do we continue to submit PASRRs to EQ as we've previously done up until March 1st? There's some great timeline information. Obi, whatever you can share, I turn it over to you.
Yeah, thanks, Jean. So basically, like someone rightly stated here, I believe as Jackson rightly stated. So as of yesterday, PASRs are no longer. I want to let me be specific. Level 2 referrals are no longer required to be sent to EQ Health. Those will be processed in 30 days. So we're applying a 30-day extension to level 2 referrals. Having said that, I want to also add that there is an email address that is provided for folks to send those level 2 referrals to email those. It's a Telegen email address. You can email those, but just remember that there is a 30-day extension. So when you send it there, give them at least 30 days. If they do it by March 1st, that's great. But we just want to make sure that we're giving them the space to be able to catch up with the volume, the increasing volume. I think, does that answer the question? I'll be happy to add more information or to clarify, please.
There's a
Jean,
great
you're on.
timeline. I know. I caught that one quick. I tried to. There's a great kind of list. I don't know, LB, if that's published anywhere with that bulleted list of the timing.
Oh, yeah, that wasn't it. So for everyone, sorry, I pulled that directly from the memo
Okay.
that you all received. So that information is in the memo, okay? But if I can help, if it will be helpful for me to resend that memo out after this training, I'll be very happy to do that. Oh, but actually, you know what? I'm gonna put that memo on the link, on the PASRR link. So
perfect. You read my mind.
The training material, the memo will be right there for you to access.
Oh, that's great.
Help?
Yeah, I think there's just a lot of data and details with dates that can get kind of confusing. So I'm such a visual person.
That's right.
Yeah, being able to read it. So posting it to the PASRR site with all of our other stuff, you read my mind. Perfect.
Excellent. Thank you.
So we'll get that out there. Next questions. And Obi, you put the training link up there again. Member ID. So member ID is the Medicaid ID number typically in our system. Stephanie, I'm going to turn this over to you to see if that member ID, when you're creating a member and you have to pick either Social Security or member ID, what are the parameters around what should go in that member ID field?
Sure. So if you don't have a Social Security number for a member, I know someone stated on an earlier presentation that they only get the last 4 of a Social Security number. If you have any kind of insurance ID, so whatever that ID number is, maybe on their Blue Cross Blue Shield insurance card or whatever they have, you can enter that in that member ID box, and then you can use that to search for that person in the future. If there's enough data to match, and for whatever reason, maybe that member has been put in the system twice, we will merge that into one record as long as we have enough information to truly confirm that that is the same person. But yeah, if you have any type of insurance card and it tells you that member ID, you can enter that into that member ID box so that we are able to create that user in the system, or that member in the system.
Perfect. Thanks, Stephanie. Obi sent out an email today that we need to send triggered PALs to the Telegen email. Tried today, email, but it bounced back. I will find out the date that email is no longer going to bounce back. We will get that to you. We will get that to you today and put that information with it. That is the correct address. So we'll get the dates for that. Are we keeping the same level 1 and PAL forms? We talked about this a little bit last week, and we're going to deep dive on this next week, but they are different. So Telegen has a streamlined and 15 question maximum PASRR level 1 form that y'all will be completing. And we're going to go over all the questions that are in there. What happens? They're all yes or no questions. So we've definitely streamlined the form. You will be uploading clinical documentation with that online screening document. with those 15 online screening questions. You'll be uploading a recent H&P, the most recent one you have, no older than 3 to 6 months, hopefully, nice and recent. That's got vitals, gets their blood pressure, shows us, how they're physically feeling too. And then a med list, a current med list. So those two pieces of clinical information just get drag and dropped, uploaded when you create the level 1 and you answer those 15 questions. So it is a different form, but it is the same form, regardless if it's a pre-admission or a post-admission. We've got a difference in the system that we're tracking those with, but the form itself is the same. So that's a great question, Zach. So we'll deep dive on that next week. Come on back. Will the notice of determination still come from the state? Yes, it will. So the state has access to our Qualitrack system. So they will be able to log into Qualitrack, view the level 2s, view all the work that's been done, and then they issue the notice of determination letter from within the Qualitrack system. So it's all in the same system, but they still own the authority of being able to sign those letters and decide when to send those letters and attach them. So that's a nice hybrid option there. Because we can no longer submit to EQ as of yesterday, do we need to just wait until March 1st to trigger? No. So hopefully that again, the website or the email that we've provided, we're not going to be taking action on anything until March 1st. But we do have the email address available if there's something that needs to be submitted. But as Obi mentioned, there is a 30-day break on those. So you do not need to submit a level 1 until March 15th. But the system will be open on March 1st. If there is any more information that is needed, does an email go to the user? Perfect. So I just mentioned that the 2 pieces of documentation we will need is some kind of history and physical, some kind of recent evaluation that's got their vitals and review of systems. And then we will need a current med list. If we do need anything else in addition to that, because with the yes or no questions, there will be text boxes. So you will be elaborating on a yes answer. And we will want to have documentation that supports that. So if you have a diagnosis of dementia and you have the neuroimaging, you have the test results to speak to that, you may upload those as well. There's no limit on how much you can upload. It's just our minimum is an H&P and a med list. But please upload anything additional. If we feel like there is something additional that we need in order to process your level 1 because of something you manually wrote into a yes field, into a text box in our system, we will send you a formal electronic request for additional information. You will get an email will go to the user that submitted that. So as Stephanie was talking about, all Qualitrack accounts have an email associated with them. And so that's the email that we send notifications to for whichever submitter and user ID is on that level 1 submission. So we will be able to send information to that submitter saying, hey, we need a little bit more info from what you individual user submitted. However, any user connected with that organization's NPI is able to see the request for information task in the system. They won't get the email notification, but when they log into the system, they would be able to see that there's a request for information task. So if you do a work share, we've got a whole department that works on PASRRs. Maybe person A submitted it, but person B is the one on shift the next day when the RFI comes through, or later the same day. Person B will be able to log into Qualitrack and see it, even though person A was the one that got the email. So that's how the system works in terms of the visibility and ownership. So hopefully that was helpful there too. Because we can no longer do it, we just covered that.
Jean,
yes.
Can I add some information from our previous response?
Yeah, please.
To some of the questions around post-admission level 1 updates, triggering and non-triggering. So, since this is the nursing facility group, I think this will be most appropriate to share this with this group. So just to clarify, because it's important that we provide clarity to not mislead anyone. So what the bulleted information that was sent out first was in the memo, and then I sent out a reminder this morning. So what we're saying basically is all non-triggering post-admission level 1s will be processed by EQ Health until February 24. All non-triggering PALs will be processed by EQ Health. Triggering PALs, which is going to be basically sent for level 2 referrals, those EQ Health is no longer going to process those. Those are the ones that we're talking about giving a 30-day extension so that Intelligent will have the time to be able to catch up on those. Just wanted to clarify those 2 points. If anyone has any question, please go ahead and ask us so we can respond to your question. Thank you.
Obi, would you mind if I put those bullets in the chat feature, or should we wait until it's posted?
Sure.
Yeah, I can put
Yes.
that there. All right, I'm going to copy and paste
Oh, yeah.
that. So,
Okay.
because I think all of that's really important. And it is, again, a lot of bullets with heavy data, but I'm going to go ahead and send this to everybody through the chat so that you can see.
Okay, great. Thank you.
Yeah. So there you go. All that good information is right there. All right. So I'm going to go back to our questions. Obi, thank you for jumping in. All right. Is PASRR only for Medicaid facilities? If you are only private pay or Medicare, does this apply? For Medicaid licensed facilities for nursing, no matter what the insurance of the member is, this is a CMS requirement for the nursing home level, for the nursing facility level. It's something that happens through an audit system. It's something that's part of the compliance and the licensing. But for the member, it's truly, it doesn't matter what their coverage is, because this is for the nursing facility. Hopefully that helped answer the question. If Obi, if you want to jump in with that one too, or Ryan, if that didn't answer your question, please re-chat something and let me know. How do we register as a user? Excuse me. It says, I know you explained the process, but I don't see a link. So the link is only there for the provider executive, and then the provider executive creates the authorized officials. Users do not get a link and won't until the week of the 22nd is when the authorized officials are going to get their email. So users won't get anything until the system opens on March 1st. And Stephanie, please correct me on that timeline. But I believe that only provider executives start the process now. Authorized officials can start their process now, but they won't get an email with a link for them to log into anything until February 22nd, because that link is only good for a week. And we want you guys to be able to use it and not have it time out. And the system opens March 1st. Stephanie, is there anything else to add there as far as the timeline?
I don't think so. I would say the only thing for if you need to communicate back to whoever that authorized official is going to be so that they know to set you up as a user, that may be beneficial so they know who all they need to get set up once that becomes live.
Yeah, I could see a lot of utility to folks making like an Excel spreadsheet of all your users, knowing the information you're going to need, right? Which is first name, last name, a unique user ID, or at least thinking what a unique user ID could look like, and then having an email address. Is all going to be really helpful information to kind of prepare for. And once the provider executive starts the process and the authorized officials are identified, then again, you'll be a step ahead. And that's what we're hoping to do, is help people prepare to be a step ahead. I should mention something that we didn't cover yet, but we mentioned on the last training, which is about unique usernames. So my name, Jean McClurkin, is nice and unique, but J McClurkin might not be. So there might have to be a J McClurkin 111 or 2 or unicorn rainbow sunny pants. I mean, whatever unique name you want to give to your people, the authorized official is going to create those usernames. If the authorized official gets into the system and starts creating a name that already exists, you will get a notification that will stop you in the process and say that already exists. Pick something different. So I think being able to start thinking about that could be really helpful too. Okay. You don't have to use unicorn rainbow sunny pants, but if you want to, I don't think it's taken yet. So what do you mean a level 2 referral? Aren't they all submitted via PALS? Shouldn't we continue to submit any PALs? Yep. So post-acute level 1s, as Obi just mentioned, and we put in the timeline, those do continue to go through to EQ at this point. But what Telligent's getting is for when they trigger. So let me just explain that part just a little bit right now. So the level 1 will trigger for a level 2 if there is an indication of a known or suspected PASRR condition, which is mental illness or intellectual disability. If there's no indication, then there's no trigger. Then there's no level 2. So for all the post-acute level ones, EQ will be looking at those until February 24th. And then they will make a determination of, is this going to be a level 2? Is this going to just move on forward? So they will be reviewing those. So it's only when if it's going to be a level 2 and it's triggered, that's when there's that 30-day break. Obi, is that another way to explain that? To really try to help that point across?
Yes, that was good, Jean. Thanks for explaining that, because I saw more questions on that. I'm glad you added that information.
Yeah, I think because when we use terms like triggered, level 1, level 2, those are our terms, and sometimes I don't think people know what that is. So
Yeah.
again, we're looking for all post-acute level 1 forms going to EQ. EQ will review and determine if that admission is, or if there's no trigger, PASRR process is over, congratulations, or if there is a trigger. And then that's what the difference is. And you should be informed which outcome it happened. So you should know that. All right, next. So we will be receiving the NOD prior to admit then. Yeah, once we go to this new system, right? Once we get the 1135 waiver timeline over, we will start doing the notice of determinations, the PASRR level 2 evaluations, all of that before the nursing home admission. There are going to be exceptions to that because there's a lot of provisional admission exceptions. So we will cover all of that next week. But ultimately, the goal of PASRR as a federal requirement is that if needed, a PASRR level 2 evaluation is conducted prior to admission so that when that person admits to a nursing facility, you have some treatment plan ideas, you have all of that information, and you are really set up well to help that member succeed in your care. That's the whole reason why we're here, is to help set members up for success at the level of care that's the most appropriate for them. So that is the goal that we are moving towards. There is the 1135 waiver right now, which has really kind of changed that timeline so that that's no longer a pre-admission requirement. They're pretty much all post-admissions now. But that date of the 1135 waiver, we covered that a little bit last week. Again, we will deep dive into this tomorrow or next week, and a lot of the content from Q&As will be posted for you as well. Next up. So the system is for IDD triggers as well. Correct. This is the system for both mental illness and IDD and related conditions. So this is truly a one-stop shop for PASRR conditions. So thank you for asking that, E. Hamilton. Zach, now, is this going back to how it was when we used OBRA? I think that's a great question. And I know we got the state folks on the line that might have more of that history. So I'm not sure if Shelley or Obi, if either of you want to address this question real quick.
Jean, sorry, what question are we looking at? Apologize for that.
There's a question from Zach saying, is this going back to how it was when we used OBRA?
No, it's not. It's going to be totally different. And I hope I'm understanding the question before responding.
We're going to be unique. We're going to be unique.
Well, let me just answer something, and if I don't answer correctly, help me out, and I'm very happy to respond again. So this is going to be a technology-driven, fully automated process, totally different from everything that we've had in the past. So it's going to be different in terms of the framework and the process for submission and review and documentation. All that is going to be totally different. But if you're talking about the clinical piece, like the level 2 evaluation, the criteria, the principles behind the review of the level 2 evaluations and the decisions around making level 2 determinations, those have not changed. Those are going to remain the same. I hope that answers the question.
It's a little hard to hear you, Obi, and it may be my audio, but it was breaking up a little bit there.
Okay.
So we do have about 10 minutes left, and I want to make sure we get through the rest of the questions. So Zach, if you have additional questions, just email us, let us know. I'm going to put my email in the chat, and I can get folks connected if I don't know the answer, because I do not know everything.
Yeah. Can you hear me better now?
Yes, that's much better. Thank you.
Okay, yeah. So what I was saying was that the processes in terms of the technology and the automated process is going to be entirely different. with Telligent. However, the clinical piece, like the level 2 evaluations decisions and the letter of determination decisions, those have not changed. Those are going to stay the same.
There's some other great questions here. We have a lot of questions about timeline. And I do want to say we've put the bullet points in there from Obi's email that has dates and walks things through. So hopefully we can help shed some clarity today, and we will talk again next week. But again, through February 24th, all of your level 1 forms will get completed through EQ Health. They will review those. Starting on February 24th, you will email those forms to Telligent, or know that you can start doing it on the 1st, on March 1st. Because Obi, is that correct? They have that 30-day break and they don't have to email it to us. They can wait till the system goes live.
Yes, that's correct. Also, in addition, everybody, please remember that the 1135 waiver is still fully effective until April 21st. So yeah, so just want everyone to remember that. Yeah.
Yep, we're dealing with a lot of different timelines, a lot of different. If this was the Avengers universe, we have a couple different timelines going off right now. So we'll all come together at the end, and everybody will come back to life. It'll be great. What if it's being triggered due to an expired short-term approval? Another great question. So the category right now, they're called categorical determinations. That term is changing with the notice of proposed rule to provisional admissions. There is always going to be reasons for a level 1 to be kind of fast tracked with a provisional admission or one of these categorical determinations, like exempted hospital discharge. All of these terms we'll talk about more next week. And then when those timelines expire, which could be 30 days, could be 14 days, then a new level 1 will get submitted to kind of start that process over. So that's how that will work. Those short-term approvals are still there in effect. Our facility has identified our executive user. Will our executive user be sent an email to set up the facilities account? No, that'll be the authorized official. The provider executive, all they do is start the process and sign. And then after that, everything's the authorized official who will get all this information. Who's coming to do assessments? So we've got our process for the level 2 assessments is going to be primarily virtual through telehealth platforms. We also do partner with local providers in the state of Colorado. We have a very thorough vetting process to make sure that if we are going to do a telehealth assessment with a video conferencing software, that the member can participate in it. It has to be member-centric. If the member has either disorientation, confusion, or paranoia, or any other behavioral condition or symptom, hard of hearing, needs sign language interpreter, anything else that could interfere with a video conference, we will schedule that as a face-to-face level 2, where someone from the community will come out and complete that assessment. But other than that, for folks that can engage via a video chat, we will do these telephonically, which allows us to be very efficient and quick with the turnaround times. I have seen this happen same day, where someone submits a level 1, it gets reviewed, the level 2 gets scheduled, and it happens that afternoon. So technically that can happen that quick when we embrace the video conferencing platforms. And we've had a lot of success doing that in Montana and through our IDD assessments all up and down the East Coast. So we're looking forward to that. Okay, we put the memo there. I've got my email posted to everybody, so feel free, email me questions. Again, we're going to be meeting again next week. Will the Department of Health be aware of a period of time that PASRR is not accessible? I'm not sure, because the Department of Health, I believe that's your question for auditing purposes. Obi, do you want to cover that now? We've got 5 minutes, or do you want to follow up with Maggie offline for her question?
Yeah, so actually I saw those questions. I just added my email address.
Okay.
There's some really good questions here that I would honestly like to chat with them outside of this forum because of time, so I can better provide that needed support.
Okay. And status change, yep, same thing. Resident review is all going to be that same level 1 form that we're going to use, because we've really tried to streamline things to make it user friendly for folks. But we'll definitely treat the resident review part of PASRR, because PASRR stands for pre-admission screening and resident review. So that RR is just as important as the PAS part of it. So we do treat those the same as well. And I think this will be the last question we take today, and then the rest of it will be published. What will be the time length for an assessment to be completed? We use their suggestions and greatly need them. Yes, so we have a 5 to 10 business day window to get these completed. And like I said, I've seen them happen exactly the same day from top to bottom, which is a great way to do it. We want to get these to be done timely. The only reason they could ever get delayed up to that 5 business days is if there are the need for in-person scheduling, as sometimes scheduling those in-persons can, just take an extra day. But if we can do them virtually, we can usually get them done either same day or the next business day. So we definitely want to be as quick with those as we can. Timeliness is a huge concern for Telegen because we know how important it is for you all to have that information. We don't want to be a delay in the hospital. We don't want to be a delay on admission. We believe in the spirit of PASRR and that this has value to the member, but it only has value if you get a copy of it, if you're able to use it. So that's where it has to be completed. All right. I think that's probably all the time we're going to be able to do today for questions. I will summarize this entire Q&A in a published document so that you can have it in writing and get to see stuff. Stephanie, would you be able to hit our last slide real quick? Thank you. So I just want to remind us why we're doing this, because this is an important process. We've talked a lot about dates and when to do what and where, but the why is just as important to remind ourselves about. So PASRR is a person-centered process. It's an objective clinical assessment. So it's not done by someone who works with the member that can add benefit for additional services. This is a vulnerable time for folks with either an IDD or a mental health disability, and their needs are important. So being able to have extra attention paid to that is of value. PASRR has been around for over 3 decades. So this is a very long-standing process that's been around and continues to stay because it has value. I do believe that. And again, it's a opportunity for clinical interaction, not just paperwork, not just compliance, not just giving you something that you're going to put in your file for the member that's there when the Department of Health comes to audit you. We want this to have value. We want it to have value for the member too. And like I've mentioned many times, turnaround times and the utility is very important to Telegen and how we're doing this. And also, again, as we've evidenced by the chat today, Telegen is committed to hearing directly from the stakeholders about the process, evolving it. We want to make sure that we stay agile, that we stay nimble, and we base our process off your feedback. So feedback is welcome. I believe we have 1 minute to go. So we did it, everybody. I hope that you will leave this session, this hour that we spent together, having taken something away. Something that sticks with you, something that you learned, something that you were reminded of, something that was important to you and really made the last hour worth your time, because your time is valuable. Also, will you take anything different? Will you do something different for the rest of your day, different tomorrow as a result of having been here? So thank you very much, everybody. With that, I'll close the meeting and we will talk to you all next week. All right. Thanks, guys.